Right, we'll start with some introductions. So who is the NHS Business Services Authority? Well, we are an arm's length body of the Department of Health and Social Care. We manage over £39 billion of NHS spend each year. So we deliver a range of national services to NHS organisations, NHS contractors, patients and the public. We have a purpose to be the catalyst for better health, and our vision is to be the delivery partner of choice for the NHS. One of the groups that you'll be hearing from today is the NHSBSA's Provider Assurance Ophthalmic team, and they work on behalf of the Department of Health and Social Care and NHS England. So the intended audience for today's session is ICB colleagues. If you are an ophthalmic contractor or you are a representative body, please reach out with any queries or questions to our normal routes or via an email address, which my colleague Claire will be adding into the chat box now. However, to get us started, it would be really helpful if you could add your name, your role and your organisation into the chat function. This is going to be our main way of you raising questions and us responding to them. And it will really help us by understanding who you are so we can tailor our content. So I'll also ask my colleague to add my own details in as well, so you also know who I am. But yes, so please feel free to keep adding as we go. So this webinar is part of a series that the NHSBSA will be delivering to ensure that all ICBs are aware of what the mandated and extra support that the NHSBSA can offer to assist you in when you're taking over delegated commissioning for pharmacy, ophthalmic, dental services. And obviously today we're focusing on ophthalmic services. The slide here reviews what we are going to cover today. So we are going to go through some real life scenarios about how we can save you hopefully some your commissioner capacity, improve patient care, and also save you some money. It will also be an opportunity for you to highlight the challenges that you're facing and where you really need some support. We'll also go through the processes and guidances and say the nitty-gritty of actually to deliver, say, contract management, for example, or post-payment verification, all the bits that need to be delivered to deliver these services. To get the most value out of today, we really do ask that you keep contributing via the chat box. This is to, again, allow us to tailor as much as possible. So again, feel free to ask questions throughout. That is no problem at all. And also respond to any questions that we ask. We have a far better chance of covering the detail that you need, really. And believe me, there are no silly questions. We really do repeat this because there's been a lot of change around the system. People are moving to different topic areas and different geographical areas and doing different roles. And it is a complicated topic. And also we also acknowledge there are a lot of different parts of the system. So if you raise a question that was in our remit, we'll do our very best to answer it. If you happen to raise a question that covers the remit of a different organisation, we will do our best to highlight where you can find that answer and who will be the organisation that you need to ask. We'll also do our very best to review all acronyms. The NHS has a lot. We do acknowledge this. If we forget to explain an acronym, or we've done it too quickly, or you just didn't catch it, please feel free just to let us know, and then we will go through it again in the chat box most likely. We also have a range of expert speakers for you today, and also experts that will be focusing on the chat box for you. So again, it just means that you can ask questions throughout, and you should get a response as soon as possible. However, just to introduce you to you, I'll ask all our speakers and experts to give a quick wave so you can see who they are, and they'll be introducing themselves a little bit later on. So I'm going to have a quick review now of some of the people that we've got on the webinar. So again, we can just have a better idea of the interest that we've got. Okay, brilliant. So we've got some Okay, so we've got South East region covered, and West Essex, and South East as well, and North. Right, so we've got some great geographical content coverage, brilliant. And we've also got quite a range of different roles here as well. Okay, so we've got prescribing leads, we've got a nurse, prevention and control nurse, sorry, infection prevention and control nurse, pharmacists as well. So great. So we've got quite a range here. So we might get quite a rich variety of questions. Brilliant. Guys, please keep going and we will be reviewing everything. So let's move on to slide 3. So this is, we wanted to start off with a question to you. This is again to help us understand how our current service can help you. So this is the first question that we're going to ask, and this is just one of 3 throughout the whole session. So the question that we're going to ask here is, what are the challenges you currently face in relation to ophthalmic services within your ICB? So again, feel free to use the chat function as much as you can. We've had quite a range of responses in the past to this question. Capacity, for example, recruitment, health inequalities, tackling health inequalities, could be even quality of care. So as much as you can, please feel free to respond to this question in the chat box, and then we will be able to tailor as many scenarios as possible that might be able to either address some of the topics that you mentioned or give you a few links that might be of use. But also, if someone's written something that you think, do you know what, that's also what we're facing, please feel free to like it, and then we get a better idea of the common topics that are facing you. And then, oh great, I think we've got a few more responses coming in. Let's see what we've got. Okay, so one of the responses we've got is understanding provision of care at place and neighbourhood, where the variances and uptake of services. Okay, brilliant, thank you, Nicholas. And then Jude, we've also got some queries coming in here in terms of prescribing. It's not on our radar, and it probably should be. Okay, okay, we'll review that in relation to obviously the ophthalmic services that we're discussing today. Keep replying, guys, keep liking and responding, and then we'll keep an eye. We can just see what are your main concerns and challenges that you are facing. Right, I'm now going to pass over to my colleague Michael. He's now going to go through our data platform with you to give you a better idea about what data is available. And he's been here for a number of years, so he'll be in very good hands. So I'll just pass you over to Michael.
Thank you very much, Liz. So I recognise a few familiar people on the call today, but a lot of people I've never met before. So just to introduce myself, Mike Duncombe, Data and Insights Senior Manager at the NHSBSA, cover ophthalmic and dental primary care data. And so before I go on to this slide, just to make you aware, as Liz alluded to just now in her introduction, there are going to be some acronyms we're going to use throughout the presentation. So I was just going to bring your attention to those very quickly. And so one is GOS, G-O-S, and this stands for General Ophthalmic Services. What this means is GOS contracts can be held by optical practices in England to deliver NHS site testing to the public, providing that they have sought prior approval for their contract from their local ICB. Another acronym that will be referred to a number of times is PCSE, which stands for Primary Care Support England. And it's just to note that they are a separate organisation from the NHSBSA. PCSE administer payments on behalf of ophthalmic contractors. So that they process the payments on a monthly basis that are paid to ophthalmic contractors on behalf of the NHS. And just to alert you as well, they also play a role in the later stages of 2 items that are going to be talked about in more detail further on in this presentation, which is GOS contract management and also post-payment verification. And we're going to post a link in if anyone requires any more information about what it is, but exactly that PCSE do on behalf of optometry in the chat, so that you got access to their website if in case you didn't already know that they existed. So as Liz mentioned just now, myself and my colleague Dan are just going to cover some slides regarding our data reporting platform for optometry primary care information, which is called EOPS. For people that are on the call as well, that we do have other primary care data platforms that you may have already heard of, such as EPAC2 for prescriptions and EDEN, which is for primary care dentistry. So this, if you're familiar with any of those systems already, this system's very similar. It's an online reporting tool, which was launched in 2019. The data is presented in easy-to-use dashboards, which cover activity and eligibility. And all the parts of these dashboards can be downloaded and shared with others who do not have access to the system. They can be downloaded into either Excel, PDFs, and also into various other formats as well. The data is updated on a monthly basis and provides both data and insight to commissioners. And the level of this data and insight goes from a national right down to a contractor level via region and ICB. We've also recently launched the availability of performer level data, so optometrist level data. And so this enables us to provide additional insight around differing activity breakdowns at contract level. This also enables users to see where performers work, both currently and also historically. So this means that you can see where a performer has moved contracts or where they work on multiple contracts. They might work part-time, for instance, on different contracts, or they might have just moved contracts over the course of time, for whatever reasons. Next slide, please. And so on this slide now is just an example page from one of our dashboards. And so this just shows some sample information for the Southwest region. So as you can see, we start off with along near the top, we've got figures on the different types of GOS activity, some percentages to show what percentage of GOS 6s, which are domiciliary visits, make up of the total GOS forms. And then on the right hand side along the top, there's also how many contractors have submitted GOS forms in this time period and what the average number of claims are that each GOS contractor has submitted. And then below that, we've got a map to show you whereabouts activity is concentrated, and also some other graphs that show trends over time and breakdowns by different age groups of the different GOS activity that has been submitted to us. And then lastly, at the bottom, we've just blanked out, this is at contractor level, so we just blanked out who the contractor is for obvious reasons, but you've got that breakdown available on here as well, so you can see exactly what each contractor has submitted, either in a single month, or you can change this via the filters or at the very top to be able to see data historically or over a longer period up until the present time as well. One thing just to mention as well is that as it's PCSE that process the claims and make the payments, if anyone requires patient level data, we are actually unable to provide that to yourselves, and this would you'd need to request this via PCSE via the portal, which you can apply to get access via the link that's been put in the chat for the PCSE website. And so what we hope people are able to do using this data is to gain an understanding of ophthalmic supply in their area, and also use this data to link to other data sets such as population data. I noticed that Nick Barkworth mentioned earlier about one of the challenges is around place and neighbourhood. And so we're hoping people are able to use this data alongside other data sources to be able to recognise where those areas where supply might be lower than actually required, for instance. And next slide, please. I'm just going to pass you over to my colleague Dan, who's going to cover about gaining access to the system and the training and support we offer as well.
Thanks, Mike. Yes, my name's Dan. I'm just going to quickly cover off how you can go about getting access to the system that Mike's just covered. And once you do have access, how you can go about getting help and support in actually using the system itself. So to get access, it's simply an email across to our data services support team. The email address is up there on the screen, but I will pop a link in the chat as well with more information on how you can contact them. They will simply ask you to agree to our EUA agreement. It's just a user agreement around covering the rules and regulations for using the system. The system is available to all commissioner users, and it is perfectly free to sign up. Anyone can register for access, and you just need a standard internet connection to be able to access EOPS. Once you are registered, we do have a series of training material that's available to help you get the most out of the system. We run a series of webinars that are online webinars that give you initially an introduction to the system, but you can have as many of those sessions as you require, and they can be used to address any issues or any problems you might be having with the system, or any help you might want to be getting to get specific sets of information out of EOPS. To go along with that, there's also a range of training guides available. There is a glossary for the system that will cover all of the terms used within it and all of the different reports, and really gives you all of that dashboard information to help you get the most out of the EOPS system. So I'll pop links into the chat where you can access all of that information on our website. But that was just to give you a really quick idea of how you can access EOPS and how you can get the most out of the system. So I'll hand back to Mike for the next slide.
Yeah, thank you very much, Dan. So some of this may not make a lot of sense currently, but the other presenters will be going into a little bit more detail around some of these items we're just highlighting here. So this is just additional information we're looking to make available to ICBs in the coming 2 years. So we're wanting to make any processes run by the NHSBSA on your behalf as transparent as possible by enabling any data that's being collected by ourselves to then be shared back to ICBs. And so we're looking to display information on risk-based sampling, the ophthalmic PCAR. I believe PCAR stands for Primary Care Activity Report. It shows numbers of contracts. Like I say, these items here are going to be covered in the slides that are coming up. We're also looking to provide some regional level and ICB reports on the activities that our provider assurance colleagues carry out on your behalf. And then also we're looking to add population data into EOPS alongside the activity data. And fingers crossed, we're waiting on receiving financial data from our PCSE colleagues, which should then enable us to be able to report on payments that are made to contractors on a monthly basis as well. And I think that was the last of. Oh, there's one more slide. I think Dan's got another slide. Oh no, we haven't.
I will just quickly cover off the questions that have just come in the chat. Not a lot of questions have come in, just to run around, obviously asking for patient level information within the EOPS system. As Mike mentioned, unfortunately, we're not able to provide that, but there is a link that we've shared in the chat that Mike mentioned. You can access that via the PCSE portal. Apart from that, we'll just hand over to, I think it's Mark next with the next slide.
Thanks, Mike and Dan. Good afternoon, everyone. I'm Mark. I'm one of the service delivery managers on Provider Assurance Ophthalmic. And over the next set of slides, myself and my fellow service delivery manager, Linda, will be going over reviewing the mandated support that's available to you from our team in the NHSBSA. But first, before that, we do have a second question for you. And it's just if you can jump back on the chat function again and just answer if you can the following question regarding, do you actually have any particular concerns around taking on commissioning responsibility for ophthalmic services? Once we get to know these concerns from you, again, we could help us try and tailor the content that we share from you with you from the speakers and the buddies on the chat. Are there any things like making data available for strategic decisions? Are you unsure how some of the contracting processes work? is about creating patient care pathways. Anything like that that you feel that hopefully we'll be able to, some of it will be able to show you over the next few minutes, some of the support that's there for you in place, or what else we might be able to you might be able to speak to us about. So I see Louise has about the data. Mike's answering that. If you haven't got anything in mind, just please put in the chat as it comes up, and we can come back to it later on if there's anything that you do particularly want to raise. Again, if somebody just put something that you agree with, please put us a thumbs up so we know the volume of agreement around those particular concerns. But if we go to the next slide for now, please. The next few slides are going to be covering just provider assurance as a whole. So this is just a timeline regarding provider assurance of when we started. And as you can see from this, NHS England have been working with the NHSBSA since 2015. And from an ophthalmic perspective, we've been involved since 2018 in provider assurance. And this to help develop integrated performance and contract management services. These were initially to address issues and concerns about levels of financial and quality controls exercised by commissioners, but these services also support commissioners and contractors to allow both to work more efficiently and develop better services. This has led to, since 2015, we've generated a gross benefit of over £307 million, and that includes financial recoveries, behaviour change, deterrent effects, and other changes in around efficiency. And there has also been the management over £714 million worth of contract performance and delivery adjustments. Next slide, please. So these are some of the benefits that we offer, but just to try and group some of them together, we do help support and facilitate delivery and management of primary care services in an efficient way. We do offer standardised performance and contract management across England for all the services, and this also applies for Wales as well for NHS dentistry. And we help deliver quality and value for money, and we do provide direct support to commissioners and primary care contractors with these services. Provider assurance, we do have robust processes in place to identify areas of variation, risk, and complexity, and we do use evidence-based approaches to help design and conduct reviews using the data and the contractual expertise from commissioners, as well as the expertise that we've gained through working on the process. And we do sort of look to make sure that any focused assurance activities are consultative with commissioners and are proportionate and consistent, and hope to develop improvement and behaviour change across contractors across the country. And this is striving to deliver a national, regional and local service, but again, to make sure that there is an effective and consistent delivery of services in the health and social care sector. Are there any questions so far, Claire?
Yeah, we've got a few, Mark. Just off when we asked if any of the ICBs had any particular concerns about taking the responsibility of commissioning on. One of our questions from Samantha was concerns about taking on commissioning responsibility for ophthalmics. Which NICE guidance is relevant? How is compliance monitored? How do providers link with specialist acute providers? And then she's also asked, how is patient experience measured, and how are patient outcomes measured and reported?
Well, I'll have to probably take some of that away from Samantha, just to answer in a bit more detail. We'll look to get back to you probably at the end of the session with that. For patient outcomes, we do have some patient level data, but it's more as a byproduct from getting the contractors benefiting. So we don't really get as much detail from the patient level at this time. But so I can take it away and get a more detailed answer for you after this presentation. Can I have the next slide, please? So this is the delegation agreement, and this was in the letter. This is the mandated assistance and support that we providing, and this was in the letter from the NHS England Chief Delivery Officer Mark Cubban back at 31st of May 2022, and it stated in the letter, to support delegation, a new standard delegation agreement has been developed that covers pharmaceutical services, general ophthalmic services and dental services, while continuing the current delegated arrangements for primary medical care. And this is to enable the delegated arrangements for these functions to take effect. All 42 ICBs will be required to sign the agreement. And then from the April the 1st, 2023, so this year, we plan to delegate responsibility to all ICBs for pharmaceutical, general ophthalmic and dental services. And this was after an NHSE England assessment. So this slide contains the content from that agreement and states the services that we are mandated to provide. And I'll just go through this very briefly, but over the next set of slides, you will see we'll go into a bit more detail over these services here. So we do have contract management, we have contract assurance, we have GOS complaints, post-payment verification, which is usually shown to PPV, and the GOS for pre-authorization of repair and replacement of glasses. As I said, we'll go through these over the next set of slides in a little bit more detail to help you get a basic understanding of these services. So thanks, Liz. So first one is contract management. Excuse me. And this is the end-to-end administration for new contract applications, contract variations and terminations, basically the life cycle of a contractor who's supplying GOS services. And we do this on behalf of the ICBs. Again, it was initially with from the NHS England regional teams. And we facilitate the processing of GOS contracts for contractors based in England. This is to ensure that the service is standardised for all contractors across the country, so they know that Specsavers, for example, setting up in the northeast will have the same process if they're setting up in the southwest. We process all the GOS contract applications, terminations and variations, and these variations, some of them do include like director changes in their GOS opening hours, relocations for contractors, and we do this on behalf of the commissioning teams, and this frees up commissioner capacities as they're not dealing with the day-to-day administration of processing these applications. And then once an application, the termination or variation is completed, that we do liaise with the commissioning teams. I believe some colleagues are on here who always do have final sign-off, as the commissioning team does always remains the key decision maker throughout the process. So hopefully that does focus on this and being able to get this done. It is done as we do it as quickly as possibly can, and this should help reduce any potential for disruption to patients in areas for the ophthalmic services. Once again, we've mentioned PCAR. I'll be explaining that on a further later down the slide, a later slide. Thanks, Liz. Whoops, I've jumped too far myself. So this is just a general overview of the contract management process. So the first stage is the application submitted, and this is where the applicant submits a relevant application form or the relevant changes they are requesting. They do this via email to us. All forms and details required for this are available on our website. So our website is the first point of call the applicant should go to get the relevant information and forms to fill in. Then we go into the second point, which is a part of the process, which is where we process the application and the evidence. Once this is submitted, we review all the evidence that comes in, and also undertake any necessary checks, all the necessary checks. So it could be checking with Companies House for directors, the General Ophthalmic Council for the relevant contractor codes and correct people that are in place. Any potential issues with any of the people applying for a contract, things like that. We go into then the third section. The third point is once all that's been done, we arrange site visits with the contractors. There are 2 site visits arranged. These are both virtual. Well, they're usually virtual. Sometimes they are in person, but it's very, very rarely. One is with one of our caseworkers, and they review the contractual side of the store with the evidence, and the other is with one of your optical advisors on the commissioning team, and they review the clinical requirements. Now, this is where one of the parts of where interaction with yourselves is important. We try to arrange these site visits as early as the process as they can be, so to allow contractors and your optical advisors as much notice as possible, so the contractors can prepare for the site visits, and your optical advisors are able to book in a time that's suitable for them. That they are very busy and so, but it's important that there is prompt engagement from all parties in this. If there is any reason why a site visit needs to be cancelled or delayed, then the information is shared, so we can either be rearranged or just make the parties aware that it won't be taking place for a particular reason. So again, one of those important parts for the interaction between yourselves and us on this. If there are any outstanding actions from either of the visits, an action plan is created and sent to the applicant to complete, and they must submit evidence within 28 days that, on the action points that have been highlighted. We then move to point 4 on the process map, which is the drafting of the contract. There are multiple versions of contract type and multiple versions of this is based on contract type and the health service body or HSB status. The provider assurance caseworker will complete the relevant sections. They will then send the application pack, including the contract, the banking mandates, the visit forms, the whole kit caboodle, to the relevant commissioning team for approval. We then go into point 5, and this is where it goes a bit back and forth. The commissioning teams will review the pack. If it's approved, we will then send a copy of the contract to the applicant to review the contract and sign, and then this is returned to us, who then send the contract back to the commissioning teams for a counter signature, who then once it's been countersigned by your team, it's then returned to us, who we then send it to the applicant. As you can see, there's a lot of little stages, back and forth stages here. And again, this is another important part for making sure we have open lines of communication and sort of awareness of how where there might be potential delays in this. Prompt engagement for all sides is key to this, to avoid delays in God's services, as this is can be held up here, and so a contractor could be all ready to go to supply services for patients in the area, but because we just haven't got the signature on the document, they are unable to start supplying that service to to people in the area. So any lead-in times that could be shared from yourselves to us to help us manage timelines for parties, all parties. We can make contractors aware if we know there's going to be potential slight delays, so like people off on annual leave who might be needing to sign on sickness or something like that, that there might be delay, just to helps keep the flowing and make sure that there is not disgruntlement coming opening up on potential sides where it's just through a lack of communication being out there that we could easily be avoided. The final bit is the payment setup, and that's point 6, and we set this up on the payment system. So part 1, upon receiving the ODS, that's the Organisational Data Services Code, site code from NHS Digital, will submit to PCSE the first part of the payment setup form. This will allow contractors to create GOS claims on their electronic system once the form has been processed. Then there is a second part, which is once we've received what are called integrated single financial environment codes, thankfully shortened to ISFE codes. This is from NHS Shared Business Services, but this does require approval from representatives from your ICBs just for the final approval. But we do go through this the system for it. We then submit to PCSE the second part of the payment, which will allow contractors to submit claims for payment once the form has been processed. Again, so we have found recently, since we've taken over, this has sped up a bit, but it's again another important part that there's no unnecessary delays in the system around that time, as otherwise it becomes a financial risk for the contractors who can be submitting GOS claims but not being able to get paid for them at that point. So that is a general overview of the process. As I said, communication through all points is key, and we work well with all the commissioning team partners that we have on there. Are there any questions, Claire? No, there's a lot to take in on that.
There's just one question in the chat here that I was about to respond to from Sarah. She's asking, what is the propensity for fraud on GOS claims, and would it be PCSE or NHSBSA or both who would be most likely to pick this up, follow up, etc.? I was going to respond to say that these the GOS claims are checked through post-payment verification. So if there was any sort of regular claiming or responding to patients, then we would pick that up through post-payment verification. I can I probably give you a little bit more information offline if you need it, Sarah.
Thanks, Claire. So that's it for me for a little bit. I'll now pass you over to Linda for the next few slides.
Thank you very much, Mark. Hello, everyone. I'm going to cover the next few slides. So the first one's contract assurance. So we don't deliver this function, but thought it would be useful to highlight it as part of the delegation agreement. So the contract assurance process, more information on it can be found in the GOS iHealth policy book, which is available via the NHS England's website. And we can drop that link into the chat if it would help you. Now, the information from the Quality in Optometry, QIO, the commissioners do feed that update into the PCAR, and as has been mentioned before, the PCAR will be covered in more detail in following slides. Thank you. Could I have the next slide, please? So this one's the GOS complaints. We have just finished the GOS complaints. We closed yesterday, July the 31st. So it's contractual requirement for GOS contractors to confirm the number of written NHS complaints received for GOS in their practice. So Provider Assurance Ophthalmic deliver the survey during a 4 to 8 week window on behalf of NHS England. So once the survey is closed, and also throughout the survey as well, the Provider Assurance Ophthalmic will break down the returns into regional and ICB reporting, highlighting completion rates and non-responders from the survey. Some of you on the call, we already know some of your percentages, and then there's a final percentage going to come out once we've done the reports from the closure from yesterday. The collated information from the completed forms will then be shared with the NHS commissioning teams and national team. And the non-submissions on the non-responders are then dealt with by the relevant NHS England commissioning team. So the Provider Assurance Ophthalmic provide assurance to NHS England that the GOS contractors are appropriately recording and carrying out their activity under the GOS contract via the annual reporting. The submission window is generally only opened once. It's a one-off submission, but a couple of times we have opened it again on advice from NHS England, but that would be NHS England's decision if it was reopened. That's generally if the submission's been really, really low overall. The submission was standing at 77% prior to a closing yesterday. I haven't got the most up-to-date figure from yesterday's closure yet, but was at 77% nationally. Okay, thank you. Could I have the next slide, please? Thank you. So on slide 16, we're talking about the benefits of post-payment verification, known as PPV with us, just to shorten it a bit. So the benefits of PPV is that it means we've got accurate claims. There is the opportunity for NHSBSA to escalate to commissioning teams if we see anything unusual. We can benchmark against other contractors, i.e. get outliers, and it's saving the commissioners time as well. And also it does provide consistency. So it's a consistent process and decision making for the commissioners nationally. So it also ensures that the GOS claims are being made accurately within England. It allows for the opportunity to escalate any concerns highlighted in the PPV to the relevant commissioner or ICB. So they may decide whether to take it to the Performance Advisory Group, PAG, thus supporting the clinical patient safety. And I know there was a question about about fraud, how that's sort of like, you know, what happens there. If when we're processing a PPV for a contractor, if our caseworkers think there is something untoward going on, we will get in touch with the commissioning team and have like a virtual meeting with the commissioning team to take advice from yourselves, from the commissioning team, ICB, so that there is the opportunity there as well. Also, I've just seen a question about a 77%, an unusual response level to this submission. No, for GOS complaints, 77%, that isn't unusual. When we're going through it, it was getting to like 60%, and we send out weekly reminders via email. The survey automatically does it for us. So it's not an unusual response level for that submission. I think we've gotten to 80% before when we've done it. We never achieve 100% because there's always contractors who won't respond. So I hope that helps on that one. Okay, could I have the next slide, please? Thank you. So on this slide, we'll go through the actual PPV process. So we just bear with me while I get. Okay, so, oops, sorry. Just having a technical problem there, I do apologise. So NHSBSA launched a pilot in June 2018 to introduce a national standardised approach to ophthalmic post-payment verification, PPV, and it was originally initiated due to the variations and inconsistencies in the approach to ophthalmic PPV across England. So for the box number 1, contractor sampling, what we do is each quarter we select a sample of ophthalmic contractors to take part in a PPV exercise based upon a standardised risk-based sampling methodology, and that brings out the outliers. We share the list of the contractors with the commissioning teams and counter fraud within that commissioning team and ICBs for agreement, and to verify if any other contractors are required to be added to the sample on local soft intelligence or any to be removed. Once we've got confirmation you're happy with that, we will then go to the contractor to ask for evidence. So that's sort of like in box 2, evidence requested. So what we do is for each contractor selected, we check a sample of the GOS claims against clinical evidence presented by the contractor to provide assurance to NHS England that the claims are being made appropriately. So that's when we're reviewing the evidence, like we have in box 3. Our caseworkers look at the evidence. What they do is they work alongside our clinical advisors within NHSBSA. So if an inappropriate claim is discovered, we then contact the contractor to try and find a way of evidencing the appropriateness of the claim. So sometimes we will have to send evidence to our clinical advisor and say, you know, is this sufficient that the contractor supplied for this GOS form, or is there more evidence that were required? And the clinical advisor will advise us appropriately. If it's found that the claim cannot be evidenced, then the payment will be recovered. But in the cases where the evidence is sufficient from the contractor, but there are learning or improvement opportunities for the contractor, we may also provide additional advice and guidance. So once we've reviewed all the evidence, we do an outcome report, which is what box 4 is, the outcome generated. That outcome will have on it sort of like the recoveries, any feedback, anything for the contractor. And we share the report with the commissioning team, ICBs, before sending to the contractor. And the commissioning teams, ICBs, have a period of time to look at the reports, just make sure they're happy with them before we send them on to the contractor. Once the report is sent to the contractor, they have 28 days to dispute any of the content of the report. So generally speaking, the only dispute we generally have is on the recoveries. They don't generally dispute any feedback or anything. But during the process of PPV, we will keep the commissioning teams informed of any issues, i.e. where potential fraud may be taking place, or if we advise that a contractor may need to be referred to PAG. But at all times, it's the commissioning teams, ICBs, who are the decision makers. The PAG is outside of our remit, so we sort of like may recommend to commissioning teams, you may want to do that, but if the commissioning teams think no, then that is up to the commissioning teams. The commission teams are always the decision makers. So that's sort of like what PPV process. I don't think there's anything in the chat, is there? Or none that I can see? No. So could we have the next slide, please? So this is the benefits of the GOS4 pre-authorisation for adults. Now, the GOS4 pre-authorisation for adults, and it is only adults that we do the pre-authorisation on. It means with us doing the process, we can benchmark on the GOS4. We can give a swift response to the contractor when they get in touch with us. It's better customer service for the contractors because we can respond very quickly. And again, it frees up commissioners' capacity. And again, it is a consistent process and decision making for commissioners across England, with ourselves handling the GOS4 pre-authorisation. And it does allow the commissioners and ICBs to see where their region sits in terms of the top 5 medical conditions requesting GOS4 pre-authorisation, as well as the top 5 claimants for GOS4 in their region or ICB. These reports are generated quarterly, and it just lets you tell at a glance, sort of like, is your region in the top 5? And what are the top 5 sort of like medical conditions? There is KPIs for all requests to be resolved within 2 hours, unless it requires clinical escalation within NHSBSA, in which case then the KPI has 24 hours. This is extremely efficient for the contractor, and like I say, it allows for a standardised, consistent and national approach to the programme of work, which allows for better customer experience for the contractors. And as said, it frees up the commissioners' times to focus on different tasks. And since November 2018, when we took on GOS4, we have approved over 27,726 claims. We have rejected over 1,011 claims. And prior to provider assurance taking on the GOS4 pre-authorisation for adults, customers could face delays for the pre-authorisation. So currently now we've got 95% of our claims are resolved within 2 hours and 100% within 24 hours. So it is resulting in better customer service for the contractors and better patient experience. The 24-hour KPI does allow for clinical escalation for the complex queries that we may have. GOS4 is, I must admit, is pretty straightforward for us to process. Is there anything in the chat for our GOS4? Okay, no. Could I have, no, thank you. Could I have, thank you, slide 19 on the ball, thank you. So this gives you sort of like the process we go through. So just bear with me. So what happens is, as said, from November 2018, we introduced the nationalised standardised approach on behalf of NHS England to run the pre-authorisation for adult GOS4 vouchers under the GOS regulations. So under the GOS regulations, adult patients can receive a repair or replacement voucher, a GOS4, if they lose or damage their glasses linked to a medical condition on our approved list. When we say our approved list, this list was supplied by NHS England. We didn't pull a list of the medical conditions together. It was issued by NHS England. So what happens is the claim is submitted by the contractor. So the contractor downloads and completes the GOS4 pre-authorisation template from our website, emails it in to us at nhsbsa.peos@nhs.net. We have got all these emails at the end of our presentation, so don't worry about remembering them. Our caseworker reviews the claim So if the claim is approved, we will issue the contractor with a unique code. Contractor writes the code on the GOS form and submits it to PCSA for payment. If it doesn't have a code on the GOS form, PCSA won't put it through. It has to have a code on. And it is unique to our organisation. If we don't approve the claim, then obviously we would let the contractor know. So that is the outcome. So it's either approved or it's not approved. When it says it's got to be linked to it has a link to the medical condition, it's not enough for a contractor to put on the claim, patient has dementia. It has to actually say sort of like how it happened. So where's the link to the condition? I mentioned dementia because dementia is probably one of our highest ones, but it has to sort of like show where the link is to the condition. So is there any queries for the GOS form?
Nothing so far.
Okay, thank you. So I'll hand over to Mark again for the next slide.
Thanks, Linda. Yeah, so the next one is PCAR. No, Mike's attempted what it was, but much like the person who came up with an acronym or initialisation, I'm never sure which, you missed the C out. It's actually the Primary Care Commissioning Activity Report. For those who may have some experience of the PCAR from a dental perspective, this does share some similar DNA in places with that. It was the initial versions were developed up around the same time back in 2019, 2020. Yeah, this was introduced optometry perspective in the last quarter of 2019. And it was put in as it was to support greater assurance and oversight of NHS England's primary care commissioning responsibilities. This report is a mandatory part of the delegation agreement, and we collate this on a monthly basis. We do this we create a commissioning area report template, and we share this in a collaboration zone we have with the ICB, the ICB commissioners in the zone. We put this on there very early on in the month to allow the commissioning teams to populate the information that they need and the information we do at the same time to avoid any try and reduce any delays getting this information collated. We populate the field for the GOS contract management side of stuff, the number of GOS contracts and any PPV stats. To note, this doesn't include any GOS4 pre-authorization information. We try to avoid duplicating any information that's already been submitted. We already produce a quarterly GOS4 report and an annual one as well. The commissioning teams, for their part, they must be populate the field around contractual notices and the quality and optometry information, so breaches and things like that. After it's only about a 2.5 week period, and then we will collate the data. We'll collate this all together and create and share reports for each of the commissioning team in a tidier report shared out. There's a couple of days to allow for the commission areas to just review and see if there's any further queries. If there's nothing that comes back or needs changing, we then do collate all the information into a national report, and this is shared with NHS England. We've been doing this since January. This structure since January this year, with the ICB information there from it. What we will do is we will share a copy of the template with the slides in this presentation after this session with the NHS Futures stuff, and again, I would reach out if your commissioners do have their copies of their monthly reports as well, if you're wanting to see a more detailed version with your area's information in. Can I have the next slide, please? Thanks. The final bit that we show you here from the areas we do is the master profile database. This is the, as I say, it's first of the kind in ophthalmic services for a long time. For a number of years, there hasn't actually been a fully up-to-date list of ophthalmic GOS contractors available. There has been individual bits of this of regional. The regions have a more accurate ones, but there's been a bit of a disconnect between who's been informed about when ODS code contractors being opened and closed. They would sometimes tell PCSE, but not a regional team or NHS Digital or one way or the other. So between us and NHS England and commissioning teams, over the last couple of years, we've been working to improve this situation. We've been looking to pull together what is now called the Master Profile Database. At the moment, work is still ongoing. We've done quite a lot of work on it. This does take, it does require a significant amount of ingestion and cleansing of data from commissioning teams, NHS Digital and PCSE. There are a number of inconsistencies between the data we had from contract management activities and the data supplied from other sources have been identified, and we are working through these. We have managed to get down from what there was initially 7,500 contractors to approximately 6,690. So we've managed to get that number down. So there are a number of duplicates in there. It wasn't just that there were contractors who were closed, there were just duplicates to do slightly different postcodes and things like that. An active accessible database is not yet currently available, but if you would like a version, please, it can be shared upon request. So please do reach out. We'll have some contact details at the end of this presentation. Please reach out and we'll look to share the latest version we have. The maintenance of this database, as we now undertake all the contract management administrative activities, it means we can do routine reviews of the data we have against the contract profile data from NHS Digital and PCSE. Our caseworkers and analysts will work across the system with PCSE, the teams, commissioning teams, and NHS Digital, etc., to resolve any anomalies or inconsistencies in outcomes, and we'll continue to review the profile database to make sure, because we want this to become the single source of truth for contractors providing GOS services across the country. Future improvements, we are continuing to work with PCSE with support from NHS England on access to financial and payment data that isn't currently available, but this is what we are looking to get this in, so to be able to just to make, let's say, a more detailed profile database, so it matches up with similar to what's in pharmacy and dental and other areas, a more coherent process. Are there any questions on that, Claire? All right, I'll pass you.
Oh, sorry,
Oh.
I do. Nicola's just put one in. Can you explain again the difference between EOPS, PCAR and MPD, and is the future to keep all running or bring together?
So yeah, the PCAR is one report which is collating all our work streams together. EOPS is the data from we get from PCSE around the patient level data for a contract level that we collate, so you can see the numbers of GOS 1s, GOS 4s, and the master profile database is the contractor list. We are looking to get them all together, to work all together, so getting them together. What we're looking to get PCAR on there, and the EOPS are looking to we are looking to get a real-time link to that from the master profile database, so they can see if there's anything that is outstanding from that, and again another thing to clarify that source of truth. Is there anything else I missed out, Mike? So
That's a very good summary. Thanks.
thank you. So I
There
hope
is-
that answers your question, Nicola. So
There is one more question, Mark. What is the expected timing on the integrating the MPD with the ICB Optom supplier accounts?
there isn't there isn't at this moment. So with shared business services, we've got access to it to help set up. So if we are noticing anything, we will be feeding. We will make them aware of it. There isn't a specific any actual times now. It's more of an ongoing process within what we're doing and the access that we've got. But they should. There will be, I'm sure, a point where sort of once we've got this definitive list, we'll be able to share with SBS, and then if there's anything else that's outstanding from there, we can look to help improve that service as well. But I say there's nothing as this time with a specific time, and that would be just an ongoing process. Thanks for your questions, everyone. So I'll pass you back to Linda for a question back at you.
Thank you very much, Mark. Thank you. So this is the third and final question. So we're interested in what resources, information and processes would help you deliver your next steps in delivering ophthalmic services. So we can't guarantee that we can deliver all suggestions, especially as some might not be within our remit, but it would give us an idea of when we are considering our future development. So, don't know, is it how your payments are delivered, or is it how the data is broken down? Nothing? Well, if you think of anything, drop it into the chat and we can have a look at it. Thank you. But I have the next slide, please. Okay, so this is the tools and support. Now, we've got the sort of information for the commissioners and the information for commissioners and contractors. The NHSBSA email addresses did recently change, and contractors can now contact the provider assurance ophthalmic team at the these email addresses down here, which it's to the right of me on my screen, and it tells you which one, the GOS4 requests, the PayCar requests, general inquiries, which one's for the PPV, which one's for the contract management administration, and also the digitization for the files. We did have bounce backs in on the emails, which meant we could still access them during the transition period, so when the emails are going to the old addresses, they were automatically being then forwarded to the new email addresses, which are on the screen. Now this ends today, Tuesday the 1st of August, and after that, this date will not be able to receive emails sent to the old NHSBSA email addresses. So it'll be useful if you can take a note of or can drop it in the chat, the email address, the current email addresses that are there, because they're the ones that should be used going forward. So then we've got the tools that may be useful for yourselves, for the commissioners. We know a lot of ICBs are digitising their records to be part of a single patient record system, or just to help with processing activity. We can help with digitising patient and staff and corporate records, and this can help you. So it'll free up space. It'll cut the costs of off-site storage. It would you would gain quick searchable digital access to your files, and then you could reinvest any savings into frontline services. So there's obviously the PayCar, which is a guidance tool. They've got the Shape Atlas, and the ICBs can make data requests. And we've listed where you can, what kind of data request it could include. Don't know if there's any questions from any of that?
Nothing so far, Linda.
Nothing? Okay. Can we go to slide 24, please? Okay. So here's some contact names, service delivery managers, myself and Mark, and also the Data and Insight Ophthalmic and the Ophthalmic Insight team that you can get in touch with if you have certain requests. We can put any of the email addresses into the chat if you so wish. But it does list who you can contact on that slide. Thank you. Then next slide, please.
Right. Well, thank you everyone for this. We've come to the end of the session. If you have any remaining questions, please feel free to either add them in now and we'll come back to you afterwards, or please use some of the email addresses that you've seen and we will do our best to respond. We will be, again, this is also the case of if you would like to discuss maybe NHSBSA providing extra services in addition to what's been described in the delegation agreement, again, please feel free to reach out and discuss what would potentially be useful to you, and we'll do our best to work out how we can help. So if in doubt, just reach out to us and we'll see what we can do. There will be future sessions of this one, which is ophthalmic services. We know that for some people, ICBs are only recently taking over control of these services, and they potentially still have some support, particularly in the Southwest, for example, with NHS England at the moment, and they might need a little bit longer to work out, well, actually, what are my plans going forward and how can these things help me? So we will be running them again later in the year. And as we said, we will share the recordings and the slides as well. But yeah, if you do have any new joiners later on, we will be repeating this session, as well as some for pharmacy and dental as well as GP services. And that will be over potentially at least probably the next 6 months, there will be some available. Just to also highlight, there will be a survey sent round after this session. This will be to help us improve our delivery of this individual webinar for you and your colleagues. But again, it will also ask you about if you do have knowledge of plans at the moment that you'd like to deliver, or whether you want to find out whether something is even possible before you go down a planning route, and you'd like to investigate further about, well, actually, this is the support I would need, and you give us a little bit more information. It just helps us gather that more macro picture from what all the attendees are interested in and what they might need from us. So just to repeat again, the recording will be available, hopefully sent out later this week, assuming all the tech works, and as well as the copies of the slides, the template of the PCAR, as well as a few other bits, as well as email addresses and links. We'll also potentially send around any more clarifications as well. So if there's topics that we might think actually a bit more information will be beneficial from questions that were raised, we'll put a few more bits of information in the emails as well. And again, I think just the underlying point is, if you do have any queries, please reach out to us and we'll see what we can do. Well, thank you so much for your time, and hopefully see you soon. Thank you very much.